Hi, I'm your host, Dr. John Spencer, and welcome to another exciting episode of STEM Forward, the podcast where we dive into fascinating careers in science, technology, engineering, and mathematics.
And I'm Dr. Stephen Jones, and today we're going to be talking about careers that play a crucial role in healthcare. Medical and health services managers. We'll explore what they do, the job environment, and how to become one, and much, much more.
That's right, Steve. Have you ever wondered, who are the people that run hospitals, nursing homes, even physician offices? You know, we all go to the doctor. We might have had a trip to the hospital or two. And we know that doctors aren't necessarily running the business part. They got to concentrate on helping the patients getting better. So who are these people?
Yeah, I mean that's a great question. When I think about how many people go through a hospital, you have to have some management structure to make it all come together, and to make
Mhm.
sure that the budgets and relationships that happen within the organization go well. But we're going to dive into that today, and I'm going to ask you to subscribe to STEM Forward and share this episode with your friends.
So, segment one, what do medical health service managers do? That's a big question. So let's start with the basics. Medical health services managers are the people behind the scenes in the healthcare facility. They plan, they direct, they coordinate the business activities of the healthcare provider. They can manage the entire facility and specific departments and even medical practices. Because, one thing I guess people do think about it is billing. Hospital bills, are a big part of the medical industry. Somebody has to manage dealing with all the insurance companies, co-pays, medical records, charts, and that whole back office while the doctor is dealing with the patient.
Yeah, and there's different levels of it because the policies around hospitals also change and healthcare systems change. So somebody has to really manage that. And I think you're exactly right. They had to develop goals and objectives related to the healthcare efficiency and quality and ensure compliance with the laws and regulations and managing of budgets and supervising the people. It becomes a really complex operation. They even represent the facilitation of meetings, handling everything from staffing to organizing patient records.
And just with handling all those different types, whether facilitating meetings or in the staff, there's all types of facilities as well. So, the type of manager you are will depend on whether you're a nursing home administrator that oversees everything, admissions to resident care, clinical managers, on the other hand, oversee specific departments like intensive care or physical therapy. But I'm going to take you back because one of the things you just said, Steve, which is very important, are the organizing of patient records. Think about, and this is kind of going to show our age. When we used to go to the doctor had a chart, a big, thick chart that kept all the paper from all the times we've gone to the doctor. I
Mhm.
recently took one of my children to the doctor, and he was using his phone to
Mhm.
use a speech to text to add to her digital chart. So
Mhm.
just think about how far we've come. But in managing the transition from those paper records to digital records, and maintaining those files
Mhm.
as well.
Yeah, actually, again, when I go into, let's say, I'm giving blood,
Mhm.
they actually have this looks like a little iPad screen, and you go, you fill out the information, and you
Mhm.
check in before you see a person, and then that information goes to them, and then they know that you're there, and it moves things along. So the time waiting in the waiting room is reduced, even by integration of systems, and the managers are responsible for purchasing these systems. So
Mhm.
this is a broad field. The whole medical services managers interact with patients, they ensure insurance agents and other healthcare professionals, and they indeed are the backbone of the healthcare system itself.
Yeah, medical health service managers are definitely key players, in facilitating healthcare and making sure operations run smoothly and efficiently. Because the doctor's main goal or the medical practitioner's main goal is to
Mm.
make sure that the patient is getting the best care possible.
Yeah, and that's important as we look at all the systems and how they work together, and also want to make sure that we're giving kind of support to the patient as they come in. Um, and in our next segment, but before we're going to go into our next segment, but before we do that, we're going to also look at managers from a different perspective. And don't forget to hit the subscribe button. Do you want your students to earn excellent grades? This is Dr. Stephen Jones, author of 7 Secrets of How to Study, the nationally recognized book, and my online course. The students in your organization can earn A+ grades in just a few hours. Get the 7 Secrets of How to Study course for your students. You won't regret it.
All right, so in this segment, we're going to look at the various work environments and how to become a medical or health service manager. So let's talk about the environment. Most of these types of managers work in healthcare facilities, including hospitals, nursing homes, outpatient centers, and about 30% of them are employed in hospitals.
That's right, and Their work can be very, very demanding. Most managers work full time and sometimes more than 40 hours a week. Some even need to be on call for emergencies, especially in hospitals, nursing homes, which operate 24/7.
Yeah, it makes me think of my one of my aunts. She was in a sometimes she would have like a 12 to 18-hour shift when she worked in a hospital. So, just like many of the other healthcare related fields that we spotlighted on our podcast, it can be very demanding.
And I live with a nurse. I
Hmm.
live with a nurse, and she did critical care when she actually worked in the hospital. So she did work those 12-hour shifts, 2 and 3 days a week together. So it is very demanding.
Yeah.
So
So,
much so that they would
mhm,
sometimes give them a day off in between 12-hour shifts.
mhm. Yeah, so speaking of those demands, you might ask yourself, well, how do you become a medical or health service manager? Well, most of them start out with a bachelor's degree in healthcare or related field in health administration, or some type of business degree, or even, as Steve was just talking about, some type of nursing degree as well.
It sounds like a lot of preparation, but it demands for managers is growing, and let's discuss that in our next segment.
Wait a minute, I think you jumped. Um, Now, after I said nursing, it says, and that's not all, in addition to a degree. You see it?
Yeah.
All right. I'm a countersign.
You want me to talk?
Yeah, because so I just said the speaking of demands, and then your next line was, and that's not all. In addition to a degree, most managers have experience. You see that?
Yeah, I see it.
Okay. All right. 5, 4, 3, 2, 1.
And that's not all. In addition to the degree, most managers have experience working in administrative or clinical roles. For example, many nursing home administrators have years of experience as registered nurses before stepping into management.
And like most of the careers that we've talked about on this podcast, Steve, some of these positions may require you to have a license, such as a nursing home administrator. But, don't be worried, because certification isn't necessarily mandatory for all positions, but it can help. For instance, organizations like the American Health Information Management Association does offer certifications that can make you a more desirable person for an organization.
Mhm. It sounds like a lot of preparation, but the demand for these managers is growing. Let's discuss that in our next segment.
Before we move on, Steve, let's let the people know. Don't forget to subscribe to STEM Forward and share this episode with your network. Let's dive into job outlooks and pay next. Are you a solo entrepreneur, entrepreneur, or small business owner looking to establish a strong online presence? At Teach It Labs, we specialize in creating mobile-friendly websites tailored just for you. Our customizable templates are easy to showcase your brand without any coding experience. Plus, with our learning management systems hosting, delivering educational content online has never been simpler. Ready to elevate your business? Visit teachitlabs.com and let's build your digital future together.
The job outlook for medical and health services managers is quite impressive. Employment in this field is projected to grow by 29% between 2023 and 2033, much faster than average for most occupations.
That's huge, Steve. Like we've talked about with the other healthcare professions that we have highlighted on our podcast. It's because of the baby boomer generation, and Generation X is not getting much younger either. The demands for healthcare services has become immense, and by extension, healthcare managers will only increase. Over 160,000 new jobs are expected to open up within the next decade.
Well, that makes for a tremendous opportunity for those who are willing to invest in the education that's required. It's not just about job availability, the pay is pretty solid too. The median annual wage for medical and health services managers in 2023 was $110,680, and that's about $53 per hour.
That's definitely a livable wage, Steve. Depending on the industry that you become the manager, the pay can actually go higher. For example, managers at hospitals earn a median wage of $128,740, while those working in an outpatient center may make around $104,000 and $104,710. But that's nothing to sneeze at either.
No, I mean, that's what I call a livable wage. And often when people are looking for professions, you both need to have the passion for the profession, but you should also be compensated for the job that you're doing. The job's not all smooth sailing. While a job is rewarding, it does come with its challenges. Many managers work long hours and sometimes need to manage their stressful situations.
Yeah, if you're still wondering what other jobs might be similar to this one, you could talk about careers like financial managers, administrative service managers, or even human resource managers. And those positions I just mentioned also have a function in the healthcare industry. So you may start out your career as a financial manager or something along those lines and move into healthcare, because finances is a big component of the healthcare system, especially for all the billing and dealing with insurance companies. But all of them require a bachelor's degree, and all involve overseeing operations. And later on, you might want to get, a graduate degree, maybe get a master's of business administration. And some of them may have a healthcare component or a master's in public health or something along those lines to help bolster your credential and your flexibility within the job market.
And the other aspect of this is that there's always ongoing education. So with that ongoing education, you can increase your potential ability to advance within the careers that are in the field of health management. So you won't feel stuck, because there's many, many different opportunities as you grow, as you become more knowledgeable.
Definitely.
And so the real difference is that there's, a focus on healthcare can vary from industry to industry. I think you did a great job of talking about healthcare for senior citizens. Those are 24-hour places, hospitals themselves, and the different aspects of the hospital, emergency room. All of it applies in terms of managing it. It has to be managed. And as we said before, the outlook for this profession is robust, with many opportunities on the horizon.
So when you think about it, if we're talking to parents about possible careers for their children, this is not something that would necessarily come up like being a manager, or you may hear children, especially in K-12 say, I want to be the boss one day. I want to organize and I want to do things. And so this is a career that you can expose children to, because like you said, the growth, 29%, 160,000 jobs in the next decade. That's a great opportunity for a lot of different people.
Yeah. Well, I think that, the whole area of healthcare management is something that are in our different communities and different job opportunities at the high school level. Many students have an interest in medicine. They all think that they had to become doctors, but they don't understand there's a whole another side of management. If they like numbers and they like working with people, then this could be a real good career for them. And it's really rewarding and impactful career, both in terms of job satisfaction and the financial compensation. But we wanted to give you a bigger picture of the opportunity. So this kind of wraps up our discussion about health services managers. I hope that you enjoyed it. I think it's been a great episode about, what can be done, what can be offered in this career. We're going to ask you also to continue to subscribe to STEM Forward and share it with your friends.
And one little note before we sign off, Stu, just made me think of that. It's kind of like a web. The doctor or the healthcare providers in the middle, but you have a web of people around them that allow them to give the patient that service. So they're not worried about the ancillary things. So yeah, this is definitely a great opportunity for people. As Steve said, make sure you subscribe, share our podcast with people that are interested in STEM careers. But thanks for tuning in. We'll see you next time with another exciting episode of STEM Forward.
Thank you for tuning in to STEM Forward. For more information about this episode, visit our website and check out the show notes.